So this panel is going to be focused on how we empower you as patients with knowledge tools and resources that will help you navigate your diagnosis with confidence. As you can see, the panel has on it patients, caregivers, healthcare professionals who will share their either personal stories or insights or tips into how you can master your glaucoma journey. So as we go ahead, I do have questions, and we'll get right started off the bat. So the first question I'm going to ask here, let me go to Jackson's mom. Why is advocacy important?
I could say advocacy is very important, especially for parents to just know to know the signs for glaucoma, and early detection is key. Because when we first found out about Jackson, he was only 3 months old, and there were certain signs we noticed, not really knowing that it was glaucoma. As far as like the cloudy eyes, having the bluish, grayish eyes, and not being able to track toys, it was very important for us to talk to his pediatrician, and then that's when we found out that it was glaucoma. It was something serious. So it's very important to spread awareness so people can know, and also to be aware of the signs, even for adults. It's not just for children, it's for adults as well.
Excellent. Dr. Cummins. So if you were to give advice to all these wonderful people in the room about preparing for their doctor's appointment, what things would you say are important for them to consider and to prepare before heading in there to their appointments?
Absolutely. I really encourage the patients, and I send a questionnaire out beforehand to kind of really narrow down some things that they're frustrated with. Everybody wants just a new set of eyes, and I can't do that, so I'm trying to find how we can augment the vision that they have remaining. And so if they can bring all the equipment that they're using, we were talking about the iPads and their iPhones and the Androids, bring that all. We'll go through all those things, kind of pinpoint, are they having more of a struggle on the road? Is it more of a struggle in their home or at the office? The more detailed they can be about where they're struggling, then I can really drill down and try to get them the equipment that they need for those tasks.
You know, it's interesting that you say that, because when I, as a glaucoma specialist, have a patient who needs to see a low vision specialist, they have a list of all these things that they want to do, which is everything. And I always tell them exactly that. You have to write your list of the things that are in the order that it is most important to you, because not every single piece of equipment does everything. So you kind of have to prioritize so that at least as much as possible, your low vision specialist can help you hit the most important targets on that long list of things that you want to improve upon. So in coming to my own type visits, you know, when you come for an IOP check, many times patients come, sometimes they don't remember what medicines that they're on. Sometimes they come, they don't know if they need refills. Sometimes just the history of their disease is unknown to them. Keeping a little logbook is really important, where you can store all the important information, your highest pressure. You can go in there and, you know, what medicines you're currently on, if there was a change that was made, if you had any other eye surgery, you can log it in this little book. And there's one lady that I have, she's so good about it. And because of that, she can flip back in her book or in her phone, wherever it is, to tell you what it is that she has or what she had done when she had it done. And it's helpful for you to get your refills so you don't run out of medicines when you know that on your bottles, I have 2 refills left when your visit is in 3 to 4 months, so we can send your prescription. So ways to prepare. There's more information on the Glaucoma Research Foundation website, how to prepare for a doctor's appointment. Viviana, the next question is yours. What is the ASPECT program, and how can it benefit a patient?
Yeah, so the Aspect program is a national initiative that was started by Prevent Blindness, and it was created to help patients who are experiencing vision loss, or even their caregivers, and even some healthcare providers, really anybody who's interested or passionate about eye care. And it's geared to help them sort of feel confident and empowered in using their experience to speak up and make a positive change in the community. So ASPECT stands for advocacy, support, perspective, empowerment, communication, and training. So that's really what the whole program embodies. So it's a 10-week course, all virtually, and it's held every other week, where patients will first learn about different eye diseases and how they affect the eye. Then they'll learn about the importance of communication and how to use storytelling in order to enact a positive change as it relates to advocacy. And then also sort of build your own community. So it's a selected list of participants, so you get to grow really close to those participants. Many of them are going through similar lived experiences. So hopefully by the end, you feel confident in telling your story to make a positive change in the world, whether that's, changing laws or something local, a local initiative you want to start, just sharing your story more confidently to make change.
Thank you for sharing that. Caroline, this one's yours. So you did such an excellent job at the beginning of the meeting, sort of giving us insight into your glaucoma journey. So if you had a patient who was newly diagnosed with glaucoma, what do you know now that you wish you knew when you were first diagnosed that you would share with that person?
It's a great question. I'll first jump on Viviana and say I attended Aspect in 2023. For any of you who are highly engaged in this conference and enjoy content like that, definitely, investigate it. It's a terrific program. I guess, gosh, I wish I knew a lot of things. I think your advice, and I attended your seminar on how to prepare for doctor visits. I agree with you, that's really important. Again, you heard my journey. I've traveled. I didn't list all the cities I've lived in, but every time I had to start over with a new specialist. And at the beginning, I didn't have all of my notes. I didn't always have a full copy of my files, but I learned to do that and then to build upon that. I'm a little more digital. I like to have it on my phone. You can have it in a notebook or wherever. But I have found the last couple of times I've had to change doctors that it was really helpful. So I would encourage all of you to take your advice and to do that.
That's excellent. So I'm going to switch a little bit to, I love Jackson. He's busy. I'm gonna ask, what advice would you give to parents of children with glaucoma? So what I would do is I will give it to him and turn it off and then use one that's live, so that way he doesn't struggle with you.
Okay.
Go ahead.
I'm sorry, what was the question?
What advice would you give to parents of children with glaucoma?
Okay. The advice I would give to other thank you, Jackson. The advice I would give other parents is to know the signs and the symptoms. Also, because the experience we went through with Jackson, now that he has a sibling, we knew what to look for, and we were very proactive and went to our glaucoma specialist when he turned 3 months old. And also just the advice I would give to another parent is keep up with the doctor appointments. You don't want to miss anything because it's very important to keep the pressures stabilized. So any surgeries that's important, you want to go ahead and do it. Be very proactive.
Don't worry about him. He is having a good time.
Yes, ma'am.
We are having a good time, and just leave him alone. Just keep going. He's not bothering us.
Yes, ma'am. But and that's pretty much it. Just knowing the signs, being aware, and just also just being very proactive when it comes to the treatments, and having a good support system that helps a lot as well. I know for us caregivers, especially the mothers, I spoke about it before, how when Jackson was diagnosed, I took the guilt. I felt the guilt or the blame, like, oh, was it because of me? Or because he had it since birth, well, was it something wrong with me, my pregnancy? So something I would tell another parent, just have that support system, know it's not you, and pray daily, of course. And our support system, it's not just our family members, it's also our church members as well.
Thank you so much. Erica, it's your turn. Thank you. My most communicative panelist up there is Jackson. He's doing an excellent job. Erica, it's your turn. What has been your experience with home tonometry? I know you work with eye care, and you also are a patient with glaucoma. So what has been your experience with being able to do, or at least share home tonometry with other people, and what is the feedback you've had from patients who actually use that piece of equipment?
Sure. I think any glaucoma patient has sat in the chair, after 3 months, and you get to come back and get your pressure, and you feel that, anxiety of, the blue light's coming at you, and you hold your breath, but don't hold your breath, right? You don't want to do that. But, you're waiting for that number, and it's all about that number. And, what's it going to be? What's the next step going to be? And with home tonometry, and that was me for 8 years. And then I rented a home tonometer. I had one shunt and was failing, so we were looking for the next shunt. And I have a very rare disease, so I'd gone to a host of specialists, and one of them said to rent the home tonometer. And so my pressure in the office was like 20, which for me actually was not bad. But I rented the home tonometer, and what we found was that my pressure was spiking into the 40s regularly. Late at night, early in the morning. So what we thought we had a few months to kind of figure out was really kind of all hands on deck, and I had surgery within a couple of weeks. So that was my beginning experience with it. After that, when I got my second shunt, I ended up purchasing one. This was before I worked for My Eyes, but I was just so passionate about it. Saved my vision, really. And I was so passionate about it that I did go to work for the company so that we rent and we sell them. But, we talk to patients every day, and everybody's story is different. But it's really, I think the underlying psychology of glaucoma can sometimes just be anxiety. And it's good sometimes too, because when your pressure's good, you then graduate. Anybody ever graduate to the 6-month visit? That's the best. So, but then you may take a step back and, all right, we need to see you in, 3 months, 3 weeks, and it's kind of all over the map. So with a home tonometer, talking about what do you bring to your glaucoma specialist, if you rent it for a week, you've got a whole week's worth of data. You take your pressures kind of around the clock every few hours. And if you own one, I take my data to the glaucoma specialist or any eye appointment that I have, and I have my data there that shows if I'm trending up, if I'm trending down. Not everybody can use it, but it's certainly, it's saved my vision on multiple occasions over the last 3 years that I've owned it.
Thank you so much for your insight. It's interesting that, the challenges that you face in life will actually guide your life's path. And that you decided that something that affected you so intimately in your life was actually what caused you to join a company to make sure that you had a story like this to tell, but also provide help to other people. So my next question is for Viviana and also for Corey. And my question has more to do with the question of when a patient should see a glaucoma specialist, and what if they don't have access to one? What would your recommendations be to them? Not only for seeing the glaucoma specialist, but somebody had asked earlier for access to a low vision specialist. Initially, I thought everybody in the room was from the DFW area, but little did I know that there were people from Austria and Nigeria and Shanghai and states all over the United States, and you don't know where everybody lives. What would your recommendation be?
Sure. So as far as, managing your glaucoma, there's a nice interplay between optometry and ophthalmology and your glaucoma specialist. So from diagnosing to managing most mild and moderate cases, your optometrist who is certified as an optometric or as a optometric glaucoma specialist can manage most cases, but there's certain instances where it's really important that you do see a glaucoma specialist. So that's if you have severe glaucoma, if your pressures aren't really responding to therapy like we're wanting to, or if we're thinking about surgery, then it's really important to go see a specialist. And then the second question was regarding access to care. Is that correct?
Yes.
Yeah.
To whether low vision or
to anything. So where I practice is a little bit unique. I work for a community eye clinic. So we're able to provide low-cost exams to all of our patients, and that exam includes any special testing you might need. So that'll include your visual field test or any scans of your optic nerves. So if we're not saying, oh, we'll skip this test because you can't afford it, or you're not surprised by bills in the mail later on. So it's something I really love that we do. And then we've also made some relationships with glaucoma specialists in the area that are able to offer reduced fees for certain procedures and for evaluations. So really, I know we're not the only eye clinic like that. We're all around DFW, and I imagine all around the country. So if that's something that you're experiencing and having issues with, then, searching perhaps a community eye clinic near you.
I'll tag on to that. That's great. I'm the complete opposite. I'm in a small, teeny, tiny practice in Fort Worth, Texas, and I don't take any insurance. I'm all private pay. So we talk about that on the phone with our patients all the time. If they can't pay for an exam with me, we have Texas Workforce Commission in Texas will provide an exam for someone with visual impairments and the equipment. And I work with Texas Workforce. If they're a student, I work with all the school districts, and if they're elderly, the Texas Workforce Commission also has a segment for patients that are retired, but they are low vision and they need equipment. So there's all kinds of ways we can get them the equipment if they can't do my private pay fees.
Thank you. And while we're on that topic, I'm going to give a shout out to AGS Cares, which is a program that's supported by the American Glaucoma Society, where you can get surgery covered by them under certain criteria. There is also another program that actually is run by the American Academy of Ophthalmology. They've changed the name a little bit, but you go online, I'll remember what it's called shortly, where you can get a free eye exam done by a glaucoma specialist. Do you remember what it's called, Ron? The AAO program. And then they changed the name, but there is a program. I'll remember it before we leave. And then lastly, I'll give a shout out to the Cure Glaucoma Foundation, which is another foundation locally run through our practice that allows patients be seen at a very low cost if they urgently or emergently need surgery for their glaucoma. So we're thankful we live in the DFW area. We're surrounded by entities that help to support glaucoma patients, whether national bodies like the American Academy of Ophthalmology or American Glaucoma Society through their programs, or local programs, as mentioned, and the Cure Glaucoma Foundation. So let me jump on to the next question. So this one's for you, Catherine. What advice can you give other patients when it comes to dealing with payer systems, coupon programs, and samples?
That's a good one. I'll use myself as an example of that. I have had private health insurance through my employer, as many of you do, but not everyone. And I was not aware that there are programs offered by some of the pharmaceutical companies that assist with copays, often doing nothing other than going to the website or getting a coupon from your physician's office. So my advice would be to ask. I literally went, I won't say the drug, I went for probably 10 years and used this drug, and I forget what my copay was. My drug insurance was not that great. It was, maybe $50 or $100 a month, and I handed this to the pharmacy, and she said, okay, your copay is $10. So I did nothing other than, go through this program. So ask the question if you have private insurance. I will say it's my understanding, and I'm not an expert on this, but it's my understanding that usually if you're on any sort of federal government insurance, Medicare, Medicaid, typically those patients are excluded from those programs. But if you've got private insurance, it doesn't hurt to ask. It might save you a few dollars, and we all know some of those co-pays still have a very high out-of-pocket.
I knew I would remember as soon as I walked to my phone. It's called Eye Care America. It's run by the American Academy of Ophthalmology, and it allows you to sign up with a specialist. They'll find you someone. Eye Care America. So thank you for the update on that, the use of coupons. And I tell all my patients, whether it's your eye drops or any kind of medication, if you feel like it costs too much, there's probably a way around it. So the first thing I would do is ask the pharmacist, if you go to a good pharmacy, whether there's a coupon or something that can be applied. And if you're under 65, you don't have Medicare, you have commercial insurance, there's usually something to bring the cost of the drop down. Sometimes there's a requirement for us to fill out what we refer to as a prior authorization. And most of the doctor's offices will have the pharmacy initiate that to get your insurance to cover that medication at a less cost than what was stated to you. Then there's, GoodRx and other programs that you can look at. But definitely have a conversation if you walk in the pharmacy and they tell you your eye drop is $700. Obviously, it's not. That's not what you're going to pay. It might require some work to get the cost of the medication down. So this question I'm opening to all here. It says, what should a patient do if they feel like there is a lack of communication between a patient and a doctor? And there's different perspectives here. Or if they feel rushed during an appointment, is it looking at this from the point of view of a patient and looking at it from the point of view of a physician? I could spend an hour in a room and somebody could still feel rushed. But let's have that conversation. So who wants to get started?
I want to say real quickly, because I always get your back and any specialist's back when they come into my office, because that's almost always the first thing a patient will tell me. They just told me I'm going blind slowly and there's nothing they can do, which I know you don't really say to patients, but they're so frustrated that they don't get more information. And I always say, you guys are saving their eyes. They're saving your vision. I'm the problem solver. I'm the one you're going to dump all the energy and the psychology and the neediness on, and that's what my job is. And I have a whole hour with them. And so I always tell them, you let them do what they need to do and don't get in their way and proceed.
Go ahead. Who wants to take?
I could say as a caregiver, being in that doctor's office, I love how it's a safe space where I'm able to ask questions. When Jackson was first diagnosed, I did not understand it. I just didn't. How can you tell me my 3-month-old baby has glaucoma and he has to have surgery immediately, eye surgery? So I didn't grasp that at all. But my doctor, she really talked with us. She really explained everything. And I myself did the research also. And when I came back to the doctor, I had more questions. Well, what about this? What about it? So I love just having that safe space and not feeling judged. Because as parents, we just don't know. Can you explain that to me? And also having a peer, my husband, we usually go to doctor's appointments together because it may be something the doctor said, I didn't hear that, or I didn't hear it that way. So it's good to just have that relationship with that doctor where you feel safe to talk freely.
So what I can hear here is, and I'm going to let you chime in, is first of all, find the doctor that's the right fit. The second thing is do some homework so that you go into the doctor's office with some questions. And so that sort of guides the conversation. And then when you get in there, ask your questions. Write them down. That's one of the reasons why I say keep a little journal. Write your questions down so they're clear, because I have people who would walk in, they would ask the first question, then they can't remember the second question or the third, and then I have to leave the room, and then I get called back into the room. So write your questions down so that we can work through those questions, and then we'll work out a relationship to make sure that whatever question you have is answered. Sometimes if you feel the need to, I have some people who make an appointment to come back in. Maybe we've talked about a surgical procedure. They're not quite ready to do it. They're supposed to schedule. And then I have them come back in, and the appointment schedule says they're here to discuss their surgery. That's okay, too. Make another appointment and let it be about not checking pressure, and let it be about having conversations to answer those questions that you've written out. You wanted to add something to it, Erica.
Yeah, you said exactly what I was going to say. Going in with a list of questions, and the more research you can do to know what you're going to ask, it's terrifying, right? You leave the doctor's office and, you've been diagnosed with glaucoma. What are the next steps? So I think, that's critical to go in knowing what you want to ask. What are my next steps? And kind of chunk it. So you're, all right, this is the next step. Take it step by step. And to your point, I think you said it, that you need to be comfortable with your doctor. And if you're not comfortable with one doctor, it's okay. I think they all understand, people are people, and, there's going to be different personalities, and you have to be able to really trust and have confidence in the doctor that you have.
I wanted to add too, don't forget that you have the right to all of your medical records. So, sometimes things were discussed, but you kind of got stuck on, oh my God, it's getting worse, and everything after that was just kind of a blur. So most of the time in the chart, it's written, what we talked about, what the next steps are, and what our recommendations are. So, it might not be available that same day. It takes a moment to finish them, but it can be mailed or faxed to you the next day or a few days later. So just review that and make sure that what you understood the conversation to be is what is reflected. And if you have any questions, then I love the idea of scheduling a follow-up appointment to ask those questions.
There's a really cool app called, I think it's called the Minutes app, and it's an AI-generated app that takes minutes of the meeting that's happening, and then it will give you the exact transcript, or it'll also give you the summary and bullet points, and that would be great for patients.
So the other thing that I tell people to do is bring a second set of ears. It's just priceless. Bring a family member, bring a friend to listen in, bring a spouse to listen in on those exams. For the husbands, I say bring the wife. When the wife shows up on the visit, it means somebody was in trouble. They got home and they told half the story. So she's here today. It's always fun to see them. When I walk in, I said, "You're here today. Did he tell you half the truth?" And then there's laughter in the room. So yes, bring a second set of ears. And somehow when there's a lot said in the doctor's office, if everybody grabs a little bit of it, then when we get home, we can sort of share what we heard, and somebody else it's your backup set of ears. So let's move on to diagnostic testing here. So this question says, how do I ask my doctor to share my diagnostic results with me, and how can I better understand them?
Yeah, so that kind of goes back to your records are your records, so that's something that you can have. And then you guys also mentioned, if you were ever to move, whether, move states or just to a different provider, maybe you're not enjoying the relationship you have with your current one, that's super helpful to have. But usually the tests that are done for glaucoma are going to be checking your eye pressures, doing a scan of your optic nerve, and then checking for any vision loss with a visual field test. So, ask your provider, how are you monitoring my condition? What tests are you doing? And can you just briefly go over those tests with me and tell me what it means? So, if you're stable, then that means the treatment that you're on is working. And then if you're progressing, that means, the treatment might need to be modified in some way or another. So just asking them, hey, what tests are we doing and what do they do? And just talk through that with me real quick if you could. And we're more than happy to do that.
Another thing about just learning superficially about what the tests mean, it might be a good idea for the Glaucoma Research Foundation to actually create a webinar that superficially talks about what those tests look like and what they generally, at least what normal is, so that people can go there and have a broad learning of what the different tests. I know I went through this morning, but that's kind of hard to follow all that stuff I was saying. An understanding of what normal looks like, what people with glaucoma have, and how you can read your test just broadly. My next question actually goes to the question that's asked here that says, how can a glaucoma patient access low vision rehabilitation services? I don't know what is currently out there, but what I do remember was a time when I worked at the University of Mississippi, and the eye clinic was actually in this building called the A.D. McBride Building. The A.D. McBride Building was named after A.D. McBride, and the first 2 floors of that building actually belonged to the Visual Rehabilitation Center, was like visual rehab for the state of Mississippi. On the ground floor, they had classes. On the second floor, they had dorms. And they would have people come there and leave there for, was it a month or 6 weeks? And so you would come in, you had to come in, and we went up to the 3rd and 4th floor because that's where our clinics were. But that's where visual rehab happened. I know there's another place somewhere, maybe it's in Houston or Austin, where people can go and get visually rehabilitated. Now, are those services still available somewhere? I don't know about the A.D. McBride Building. It's been a long time since I lived in Mississippi. But those people were taught how to dress, how to pick their clothes, how to use their canes. I used to say this. I would say many of them were visually impaired, but they were better dressed than I was because they just taught them how to do all of that. So if you wanted a place where you could get vision rehabilitation. Somebody's asking that question. How do we get access? Is that available somewhere in the country, or are there places where that's still available, where they also would, when it's time to go home, come to your home and do all sorts of things to make sure it's habitable and you didn't trip over something? So I'll take that question next.
Well, you've got so many options, and it just depends on the state, but Lighthouse for the Blind can come into your home depending on where you are and what city. You've got Prevent Blindness can help. In Austin, we've got the Chris Cole School where you go in for months at a time and you blindfold and you do blind. Texas Workforce, again, here in Texas, they'll do orientation and mobility. Lighthouse for the Blind will do some orientation and mobility. There's lots of different layers, but like you said, you've got to be the clever one. You've got to be really searching and researching. You've got to be a huge advocate for yourself to find some of that.
All right. Now we're leaving our homes and our doctor's offices and we're heading into the workplace. There's a question here that how do you handle patient advocacy when dealing with employers or people in your life that don't understand the seriousness of disease? So how do we work? First of all, let's do the employer one, and then we'll go on to other people who don't have a full understanding of disease, and you'll meet them everywhere else. It's in the grocery store, it's in the parking lot, it's wherever you might go to do other business, that there is not a clear understanding of even your colleagues at work. So outside of having to do your work in your workplace, but the other people who don't understand why you have to have the benefits of the things that have to be provided to you. So let's talk about workplace first. How do we handle patient advocacy in that environment?
Yeah, so there's been times when I've written letters to employers just stating, as basically as I can, what the vision is and what that sort of translates to as far as day-to-day tasks and, accommodations that might need to be done at work, or just saying, I know they're not performing as quickly as you want, but they can do the task, so they might just need a little bit more time because of this visual condition. So just asking your eye care provider, saying, hey, I'm having some issues at work, and being open about that, we're more than happy to write a letter to your employer.
Does anybody want to add anything to that conversation?
Yeah, I'll add, I actually, I primarily had a job, it's unusual these days, where I did not work on screens. I was at retail, but then I went back to work at a nonprofit, and I was doing a lot more work on a computer. I had had my cataract surgery and the MIGS procedure, and my close-up vision was really, really challenging, and I was learning how to read with mid-range or screen glasses. So I just explained I was lucky. Again, I was at a nonprofit. I had a great boss, but I said, you know what, I've not experienced this before. I'm accustomed to working on a computer, but not so quickly and with numbers like this. You can show me, but I can't necessarily see it because I'm not at the right distance from the screen. If you can show me once and then let me sit at my own desk or sit at yours, just give me 10 minutes to do it myself. I'm one of those people who learns by doing anyway, and that's all it took, you know, in my case for the most part. There were a couple times she'd try to show me something real quick, and I literally couldn't see it or couldn't process it quickly enough, but I said to her, you know, remember, I need a couple more minutes on this, and it wasn't a big deal. So I realized that's not going to be with every employer, but in my case, I was really lucky.
So the HR department of most workplaces will provide you, if you go to HR and explain your medical condition, there are usually allowances that are given for people who are impaired in one kind of way or the other. Sometimes there's paperwork that they send our way to let us know what your limitations are. And there are accommodations, just like you get accommodations in school. There are accommodations that they will give you in a workplace, whether it's a bigger computer screen, whether it's better lighting, whether it's making sure you have whatever access it is that you need. I had a patient once ask, who was visually impaired, to ask to be put on the day shift because the shift that he was on was like 3 to 11. This person had glaucoma, significant visual field loss. And so making it home at night was hard. And you could see it in his visual field. So making requests like that to a workplace to accommodate for any kind of impairment is something. Just go off to HR, and they're very good about working with you because you're protected in that kind of way to make sure that they have provisions to allow you to do your job. So how about the other people in your life? How do we handle those people who just feel like, you know, they lack that empathy, they don't quite understand why this is a different situation from what they know. And sometimes it's truly just a lack of knowledge. So how do we deal with those people? I'm not talking about the mean people, I'm talking about just the people who don't know.
I tell them to go get their IOP checked. So, no, but I think knowledge, like just what you said, knowledge, like trying to educate them. You know, family members don't always understand, and you know, sometimes they do, friends, things like that. Oh, you're having another surgery, or oh, you know, you need to travel here or there or whatever. But the more that you can educate them, I mean, and truly, some of these people have never been for an eye exam in their life. So, you know, I think being an advocate for yourself, but then you're advocating for them as well. You know, you need to go get your IOP checked as well. So it's kind of a two-pronged approach, but I think education is key.
So sounds like we shouldn't be shy about letting people know, explaining the disease entity to them, and, you know, encouraging them to, you know, go search the internet so there's a better understanding of what you're going through so that they can then be of the right kind of help to you, whether it's in a workplace or, you know, to somebody else that they may encounter in life. So being not shy about educating people. So we have had a fantastic time talking about advocating, advocating for ourselves at the doctor's office, advocating for ourselves at our jobs. The one thing I will throw in there about advocacy, and it's probably because of, you know, some of the other work that I do, is sometimes as it comes to policy, we have to advocate for ourselves. And so being engaged in what or however the government is involved with making sure your care is covered, your surgeries are approved, your doctors are treated right so that they can continue to provide the right type of care, whatever the policies that are being made as regards your disease entity is something that we have to be engaged about. Now, that's not always something that we can talk about, but sometimes we have instances where we have to share with our patients the things that we have to fight for to get covered so that we can do certain types of surgery or provide them with, like earlier on today, there was a discussion about the number of days you could refill your medication. So if you're given a bottle of medicines and it's expected to last 30 days, there was a discussion by Dr. Butler who then told us that in the state of Texas, at day 21, you could be given a refill. Even though it hadn't lasted 30 days. Well, somebody fought for that for you. And that's the truth. And there are many things like that as glaucoma patients, we have to step up to and make sure that we have the right kind of access. We're speaking out for ourselves, not just at our doctor's offices and to our employers, but to the policies and to the rules and to the laws and to the access that we get from whether it's our insurance companies or from governmental entities. And I think that advocacy is something we all need to do all around to make sure that we keep glaucoma controlled and we prevent people from losing vision. So I want to thank everybody who has participated in this panel. We're going to take a quick group picture, and then I am going to be introducing Dr. Ron Feldman. He has been here all day. He's listened to every single session, so he's going to be giving us our summation, but we'll catch that picture real quickly. Okay, come on, guys.